Every day, more than 30 million Americans open a bottle of ibuprofen and swallow a pill without thinking. Advil, Motrin, generic store brand. They take it for headaches, backaches, knee pain, menstrual cramps, and arthritis. It is the most commonly used painkiller in the country, and it is available without a prescription in every gas station, grocery store, and pharmacy in America. What the bottle does not tell you in large print is this. Every time you take ibuprofen, it inhibits an enzyme called COX-1 that maintains the protective mucus lining of your stomach. Without that lining, your own stomach acid begins to digest your stomach wall. Non-steroidal anti-inflammatory drugs increase the risk of gastrointestinal bleeding fourfold. Gastrointestinal bleeds that occur while taking non-steroidal anti-inflammatory drugs are more likely to be fatal, with a mortality rate of 21%, compared to 7% in patients not on these drugs. The side effects of long-term non-steroidal anti-inflammatory drug use cause nearly 103,000 hospitalizations and 16,500 deaths every year in the United States alone. More Americans die from non-steroidal anti-inflammatory drug-related complications annually than from cervical cancer, and more than die from AIDS. Non-steroidal anti-inflammatory drugs are responsible for 30% of all hospital admissions for adverse drug reactions, as gastrointestinal bleeding can begin as early as 3 days after starting a high-dose regimen. Ibuprofen is considered the safest of the non-selective non-steroidal anti-inflammatory drugs. A 2022 survey found that 57% of US adults with chronic low back pain had used over-the-counter non-steroidal anti-inflammatory drugs for pain management. More than half the country is self-medicating with a drug class that kills 16,500 people a year. In 2014, a team of researchers across 8 medical centres in Thailand conducted a double-blind randomised controlled trial on 367 patients with moderate to severe knee osteoarthritis. They tested a $2 route against 1,200 mg per day of ibuprofen. After 4 weeks, the route matched ibuprofen on every single measure of pain, stiffness, and physical function. The patients who took the route reported fewer gastrointestinal side effects. 96 to 97% of patients in both groups were satisfied with the treatment, meaning Turmeric achieved pharmaceutical-level patient satisfaction in a head-to-head trial. The study was registered on clinicaltrials.gov and published in Clinical Interventions in Aging. The route was Turmeric. Its active compound is curcumin. And nobody with a stake in the $15 billion NSAID market has any reason to tell you about it. The use of turmeric dates back nearly 4,000 years to the Vedic culture in India, where it was both a culinary spice and a sacred medicine. Archaeological analysis of pots discovered near New Delhi found residue from turmeric, ginger and garlic, dating to 2500 BCE. Ayurvedic literature contains over 100 different terms for turmeric, including Jayanti, which means one who is victorious over diseases. In 250 BC, Sushruta's Ayurvedic Compendium, one of the oldest surgical texts in human history, recommended an ointment containing turmeric to treat poisoned food. By 700 AD, it had reached China along the Silk Road. By 800 AD, it was in East Africa. By 1200 AD, it was in West Africa. When Marco Polo encountered it in 1280, he described a vegetable so similar to saffron that he could barely distinguish them. Indian brides still apply turmeric paste to their skin before weddings in a ceremony called haldi. Hindu priests dye their robes with it. It is one of the most widely consumed spices on Earth, with India producing nearly the entire global crop and consuming 80% of it. For 4 millennia, every system of traditional medicine in Asia used turmeric. These systems include Ayurveda, Siddha, Unani, and traditional Chinese medicine. They prescribed turmeric for inflammation, pain, digestive disorders, wounds, and respiratory illness. Then modern science arrived and asked the only question that matters to a pharmaceutical company. Can we prove it works well enough to compete with a pill we already sell? The answer is yes, and the evidence is not subtle. The 2014 Curcumin cycle trial is the centerpiece, but it is not alone. A meta-analysis of 5 randomized controlled trials involving 599 patients concluded that curcumin significantly improved WOMAC scores for pain, stiffness, and function compared to placebo, with a p-value of 0.03. Curcumin's side effect rate was lower than ibuprofen's. A separate 2014 placebo-controlled trial by Panahi found statistically significant improvement in all WOMAC parameters in the curcumin group, while the placebo group showed no change. A 2020 trial published in the Annals of Internal Medicine found curcumin extract comparable to paracetamol. The mechanism is where it gets interesting. Ibuprofen works primarily by inhibiting cyclooxygenase 1 and cyclooxygenase 2, two enzymes involved in prostaglandin synthesis. That is one pathway. Curcumin inhibits cyclooxygenase 2 as well, but it also inhibits lipoxygenase, phospholipase, collagenase, elastase, hyaluronidase, tumor necrosis factor alpha, interleukin-1 beta, interleukin-8, and nuclear factor kappa B. It does not target one inflammatory pathway. It targets the entire inflammatory cascade from multiple directions simultaneously. Ibuprofen blocks the symptom. Curcumin addresses the process. Curcumin has been demonstrated safe at doses up to 8,000 mg per day for 3 months with no serious adverse effects. Here is the honest caveat, and it is the key to understanding why the pharmaceutical industry does not lose sleep over turmeric. Curcumin has terrible bioavailability. When you eat turmeric, your body absorbs almost none of the curcumin. It is metabolized and excreted before it can reach therapeutic concentrations in the bloodstream. This is real. This is not conspiracy. If you eat a teaspoon of turmeric powder and expect it to work like ibuprofen, you will be disappointed. But here is where the outrage begins. In 1998, researchers discovered that piperine, the active compound in black pepper, increases the bioavailability of curcumin by 2,000%. Not 20%, not 200%, 2,000%. One pinch of black pepper transforms a poorly absorbed spice into a systemically available anti-inflammatory compound. The solution to the bioavailability problem has been sitting in the spice rack next to the turmeric for 4,000 years. Indian cuisine has combined turmeric with black pepper in virtually every dish for millennia. Ayurvedic practitioners prescribed turmeric with fat and pepper together, not because they understood bioavailability, but because the tradition preserved the formulation that worked. Modern science rediscovered what Indian grandmothers never forgot, and you cannot patent the combination of two kitchen spices. In 1995, the University of Mississippi Medical Center was granted US Patent 5,401,504 for the use of turmeric in wound healing. That was a patent on something Indian civilization had been doing for 4,000 years. India's Council of Scientific and Industrial Research challenged the patent and provided ancient Sanskrit texts as prior art evidence. The US Patent and Trademark Office revoked the patent in 1997. This case became one of the landmark biopiracy decisions in international intellectual property law, and it led directly to the creation of India's Traditional Knowledge Digital Library, a database built specifically to prevent Western institutions from patenting ancient remedies they did not invent. The NSAID market is worth over $15 billion globally. Pfizer owns Advil, and Johnson & Johnson owns Motrin. These are not small companies. More than 775 million NSAID-related visits were recorded in US ambulatory care settings between 2006 and 2016. The proportion of outpatient visits where NSAIDs were prescribed rose from 8.1% to 9.6% during that period. The industry is not shrinking, it is growing. And a $2 bag of turmeric root combined with a $1 jar of black pepper delivered the same active pathway inhibition as the pill in the medicine cabinet, with fewer gastrointestinal side effects, in a double-blind trial of 367 patients, published in a peer-reviewed journal and registered on clinicaltrials.gov. If this changes how you think about that bottle in your medicine cabinet, hit subscribe. We are pulling one of these out of the ground every week. Here is what you can do tonight. Osteoarthritis affects over 40 million Americans and is one of the leading causes of disability in the country. Most of them reach for non-steroidal anti-inflammatory drugs, also called NSAIDs, by fresh turmeric root or ground turmeric powder. The root looks like small ginger with bright orange flesh. Turmeric can be used fresh or powdered. The simplest daily preparation is golden paste. Mix half of the cup of turmeric powder with 1 cup of water in a saucepan. Heat gently for 7 to 10 minutes, stirring constantly, until it forms a thick paste. Add a teaspoon of black pepper and 2 tablespoons of coconut oil or olive oil. The fat further increases absorption. Store the paste in a glass jar in the refrigerator. Take half a teaspoon to 1 teaspoon daily, mixed into warm milk, smoothies, or food. Golden milk is the drink that has been consumed across India for centuries. If you prefer capsules, look for curcumin supplements that include piperine or are formulated for enhanced bioavailability. The clinical trial dose was 1,500 milligrams per day of curcumin extract. Do not stop taking prescribed medication without consulting your doctor. Curcumin can interact with blood thinners and should be avoided before surgery. Now picture this. It is 10 years from now. There is a jar of golden paste in your fridge that you make once a month. Every morning you stir half a teaspoon into warm milk with a crack of black pepper. Your knees feel better than they did a decade ago. The bottle of Advil in the medicine cabinet expired 3 years ago and you never replaced it. Your doctor asks what changed. You tell them about a trial of 367 patients where a route matched ibuprofen on every measure and caused less damage. You tell them the route has been prescribed for 4,000 years across every system of traditional medicine in Asia. You tell them someone tried to patent it in 1995, and India revoked the patent by showing ancient Sanskrit texts. You tell them the bioavailability problem was solved by black pepper, and the Indian grandmothers figured this out before the pharmaceutical industry existed. You tell them a $2 root and a $1 jar of pepper do what a $15 billion industry charges you monthly for with fewer side effects in a peer-reviewed trial that the industry has never bothered to replicate because the result would cost them customers. If you want to go deeper, head to our website where you can grab our free ebook on lost plant remedies the system forgot but science never did. Thanks for watching. Click here to check out another video and make sure to hit subscribe.